Breathing is a fundamental action that we do more than 20,000 times a day, yet we barely even pay attention to it. When was the last time you thought about your exhaled breath? Perhaps you've considered dental hygiene, or you were thinking how your exhaled breath smells. But we know that there is a diagnostic value to it. In fact, it is your fingerprint. It's not just something that you have to do to stay alive, but it can tell you a story that can monitor your wellness and any disease you might have. It could be just as useful a medical diagnosis of those found in urine or blood. But because exhaled breath is completely non-invasive and instant, there are a lot of more improvement to the conventional medical procedures it can do. A breathalyzer was the first generation of a breath analyzer that is used by police or law enforcement to check the blood, the alcohol level in a driver's blood. It uses exhaled breath to detect the alcohol level and see if the driver is driving under influence or not. At Northeastern University, we have developed a breathalyzer that can possibly detect COVID-19 from your exhaled breath.
Right now, these labs are just absolutely swamped.
2,000 people were tested today, and many of them started lining up at midnight.
The results are taking about 7 to 10 business days to come in.
From the start of this pandemic, the world faced a serious shortage of tests, and the test procedure was always inefficient. Lines snake around and people waited in the lines to be tested and waited even longer, up to a month, to get the results. I'm sure you're familiar with Northeastern University COVID-19 testing policy. Every 3 days you need to stay in a line and wait, and then wait up to a day to get your results. While an improvement, the model is still imperfect. While the biggest challenge is the delay. Imagine that in that delay, a host can just spread the COVID-19 to many patients. Here is the device that we invented at Northeastern University. It consists of two main components, the sensor and the hardware. The sensor consists of 4 layers, silicon substrate, chromium for conductivity, graphene to exploit sensitivity, and a polymer called molecular imprinting polymer, which is known for its selectivity. Graphene is a single layer carbon, and it's the first 2D material that was discovered in 1859. It has very unique properties, including its excellent electrical conductivity. Well, we all know copper, which is used for electrical wire because it is a really good conductor. But imagine that graphene is 1 million times better, more and more conductive than copper. So that's why we use graphene. MIP, or molecular imprinting polymer, is a method of polymerization around a template molecule, just like a mold. And then by removing that molecule, you will have a cavity with the exact size and shape of that specific molecule. So this is how I made those sensors. For the SARS-CoV-2 sensors, I use the spike protein. So a spike is those little tiny things around the spherical shape of the virus, and they are unique to that virus. So when we can detect that spike protein, we can detect the whole virus. And for testing, we will give the user a brand new blow tube. He can or she can blow into the device for 5 seconds, and then they can see the results in their smartphone. This is as simple as that. So compared to other current methods of diagnosis of COVID-19, this method is very cheap, instant, accurate, user-friendly, and can be done at home. We have already tested these sensors on patient saliva with an overall acceptable outcome, meaning that they are ready for clinical trial. If successful, this device can be a game changer. The sensor or the device has a variety of applications. During my PhD, I had a chance to work on diagnosis of Alzheimer's disease and lung cancer from the exhaled breath, and detecting opioids in the urine sample, exhaled breath, or from the blood. Alzheimer's disease, or AD, is a neurodegenerative disease, and it's third cause of death in the United States. It is known by decline in memory, problem solving, language, reasoning, planning, or any other thinking abilities. Contrary to people believe, it can kill a person. How? When the person's stomach doesn't remember how to digest the food. People with Alzheimer's disease need assisted living. And based on a state, it can vary from $5,000 to $8,000 a month, and it's a lot of money. The major problem with Alzheimer's disease is that it's going to take a decade in order for a physician to be able to diagnose it. But what if we can diagnose it faster, sooner? Well, we can save $7.9 trillion. It is double the budget of the whole US government for each year. So, see, it's a lot of money. And more importantly, we can save lives. Now imagine a patient attend an ER with memory loss. He or she can't even remember the address, while the hospital give a questionnaire to her or him. Well, it's impossible. And it could be other diseases other than the Alzheimer. Delirium has very similar symptoms. It can happen during alcohol withdrawal, after surgery, or drug intoxication. So when a patient enters ER, so it could be very, very easy for the hospital and the patient if they could have a breathalyzer that could distinguish Alzheimer's disease and delirium for them. So we previously tested our Alzheimer's disease sensors. We have 3 sensors for 3 biomarkers on rats. We tested on 3 cohorts of rats. So the first cohort, they had Alzheimer's disease human gene called APOE4. They were on high-fat, high-sugar diet, and they were all 2. So the second cohort, they were all 2 on high-fat, high-sugar diet, but they didn't have the gene. And the third cohort, they were healthy and young. And the sensor, luckily, could distinguish between the cohort with AD gene and on high-fat, high-sugar diet and the healthy control with 100% sensitivity, selectivity, and accuracy. Well, the testing for a breathalyzer device wasn't just limited to Alzheimer's disease. The majority research use of breathalyzers so far in medicine was about detection or diagnosis of lung cancer in the exhaled breath. During my PhD, I had a chance to look into it. And we have developed 9 sensors for 9 biomarkers of lung cancer in the exhaled breath. Lung cancer is the leading cause of death cancers in the US. and almost 160,000 people die every year from lung cancer. It's 27% of all cancer death. And it has the lowest 5 years survival rate among all other cancers. Low dose CT is the only way that you can monitor heavily smokers that are above 55 years old. But the problem with low dose CT is that it has a really high false positive. 92% false positive, which is a lot. Then you definitely, after a false positive, you need to follow with them with PET scan, MRI scan, which expose the patient to radiation, which cause another cancer, and biopsy. And after all, it is very time consuming, it is expensive, and it can be invasive too. You can get cancer from this treatment. Using the same concept that we use for Alzheimer's detection, we have tested our lung cancer sensors, and now we're doing clinical trial with Dana-Farber Cancer Institute. We also tested our sensor on controlled substances. Consider finding controlled substances in gazillions of males coming to the US every day. And this has been done by especially trained dogs called K9 at US Customs and Border Protection. First of all, it's gonna take intense training for the dogs to be able to snuff. Second, the dog can die after sniffing fentanyl or any fentanyl-related opioids. Our sensor can remedy all these issues. It could be used to diagnose drug overdose, or it can be designed to detect opioids from outside a male. So we made sensors for oxycodone and marijuana, and it can detect up to part per quadrillion, which is equal to 1 picogram of oxycodone in 1 cubic meter of volume. It is 7 orders of magnitude better than any state-of-the-art sensor to detect opioid. So imagine how easy this could be for US Customs and Border Protection or for a physician to diagnose overdose with this sensitive sensors. To sum up, we have tested our sensors on opioid detection, Alzheimer's disease diagnosis, and lung cancer diagnosis. And now we are on a way to test them on COVID-19 diagnosis. With this cheap, fast, instantaneous, and user-friendly device, we can get rid of all the lines made up for testing for COVID-19. Also significantly reduce the wait time for the results to come. And it can definitely help and decrease much the spread of COVID-19 among people. My take-home message is that your exhale breath is everything. It is your fingerprint. Maybe 20 years from now, no one goes to a physician. Just to stay home, blow into a tube, and see on their smartphones if they have any diseases.